Hi, eBESS surgeons. How about your BESS in this week? The most important and basic technique of BESS is to make water output fluent. Most complications are related with poor water output and consequently blurring of surgical view. Input water can be stopped by three barriers: skin, subcutaneous fascia, and muscle layers. So you must know how to manage these three structures trapping water output. About 1 centimeter sized, two portals are incised on the skin. 1 centimeter or a little bit more size is enough to make water out well. But subcutaneous fascia needs vertical incision under the skin and cross-cutting once more. Vertical fascia incision can easily be closed when you lay down an endoscope with skin traction. When the cross-cutting is added, and you try to lay down the scope, the incised fascia slit open wider. And it is better for fluent water output. On the surgical video clip, you should focus on the cross-cutting of subcutaneous fascia. Fascia cutting makes wider opening for water output, and it gives wider and clear surgical view without disturbed by rugged soft tissue. Then it gives a view to the SP base at the midline. Muscle dilation is also needed using muscle dilator. It makes about 1 centimeter sized tunnel through the muscle layer via fascia and skin. The most important fact is that water is not trapped by muscle layer. Actually, water runs out well, but this force pushes subcutaneous fat mass to plug the portals on the skin. So, after inserting a scope for fluent water output, the first thing you should do is remove the subcutaneous fat tissue using a pituitary punch. Please watching the video clip on routine procedure. The most important step is to remove subcutaneous fat for fluent water output. Water is trapped by subcutaneous fascia and fat rather than muscle layer.